Hey everyone, welcome to this week's edition of It's Worth a Shot, hosted by Mountain Pacific Quality Health. And this week, we will be discussing infection prevention education and taking a closer look. Hi, Liz. We'll be taking a closer look at Quality Safety and Education Portal, that QSEP portal, a free training resource for folks to provide infection prevention education. Wherever you are in the world today, I hope the weather is fine. We actually have a little thunderstorm rolling over right now here. So again, welcome. Today is June 7th, 2023. Next slide, please. So a few updates and reminders for this week. Again, the FDA is going to meet in an open session to make recommendations on the upcoming COVID-19 vaccine composition for this fall and winter. That is coming up June 15th next week. And I included the online web conference meeting that you can listen in. It looks like it's going to be on a YouTube channel. And for additional information about that meeting, you can feel free to check out that link as well, and I'll drop those in chat. Again, next week, they'll be talking about the COVID vaccines for this fall. So we'll see what shakes out. And I'll just drop that in chat for you guys right now. And then next slide, please. So another update, there we go, it's in there for you. The CDC recently updated a vaccine schedule app for healthcare providers. I am sharing this forward and wanted to just kind of get this in front of everyone, because as our vaccine schedules have changed and adjusted and we anticipate some more updates, this app I think is going to be kind of handy, because as we've gone on to websites and we see that those adult vaccine schedules aren't updated yet, this app, the CDC is ensuring as recommendations are updated, they will be updated on this app live. So I just dropped the link in there. So lots of folks love this app, easy access, look up those recommendations, and it's live. So you don't have to wait for tables to be updated. And I know there's still a delay with that information. So sharing that forward. All right, and next slide, please. And Kathy, good question. Kathy asked if there's any news or updates about the COVID vaccine, if it'll still be emergency use. And I think here, after the 15th, we'll have a lot more information. And as soon as we hear more, I will definitely share it out. And as always, feel free to drop any clinician ideas or topics for webinars into chat box. And if you have time at the end of our presentation, if you wouldn't mind completing that post evaluation, there's an opportunity to include ideas and suggestions in the bottom of that eval. We look at those week over week and reach out for subject matter experts so we can bring those topics to you. So thanks you guys for participating and completing those, because I sure read them. We do have a polling question for today. Is your long-term care community using your state IIS system to access resident vaccine records? You know, this is traditionally in nursing homes, we have not used it. And I feel like the last year we have really stepped up in using this platform, and it's helped to have a live look at residents' vaccination status, and it's really helped. All right. All right, we can go ahead and end that poll. It looks like the majority of folks said yes. If you are not and would like information on how to enroll in your state, please reach out to me and I would be more than happy to assist you in enrollment or connect you with the individual that can help with the enrollment process. All right, we can stop sharing. And next slide, please. So a quick snapshot at the COVID-19 hospitalizations, deaths, and emergency visits for this last look back period through May 27th. We continue to see a decline in hospitalizations. Deaths has always had a very strange variable in the data week over week. So there's a little bit of an increase, but again, there's this trending in data I feel is very inconsistent. So I won't hold my breath on what we're looking at right there. And then our vaccination rates for updated folks with the updated booster dose, it's hovering still right around 17%. So still time to get that updated booster. And again, we'll see what the meeting results in here shortly. And next slide, please. COVID-19 hospital admission levels, quick peek, lots of green. This is what we want to see, so wonderful news. Looks like Texas has a few hot spots of uptick in admissions, but other than that, lots of green, so fantastic. All right, next slide, please. So with that, I would like to introduce one of my coworkers from Wyoming, Callie Perkins. She'll be discussing the infection prevention education kind of platform and specifically looking at that tag F945. Callie, it's all you.
All right, thanks, Jessie. Hi, everybody. I'm glad that I could be on today with you guys. For those of you guys that receive our SOS weekly email, you probably noticed that F945 made our weekly email today. So I was excited that I could piggyback on that and do some education with you guys today. Let's go ahead and go to the next slide. So I just wanted to recap a little bit. Part of the 483.95 training required topics is the infection control, which is F945. But I wanted to list them all out because as you guys are revising, updating, reviewing your educational programs for your staff, there is a lot that you have to make sure that we are in compliance with. So just wanted to kind of do a little refresher to make sure that you guys are looking at all of the areas 941 all the way through 949 to make sure that those are covered in your training programs. So let's go ahead and go to the next slide. We are going to dig a little bit deeper on our infection control training. So as I mentioned before, you have to develop, implement, and then maintain this training program for your staff. We're going to talk about the standards, policies, and procedures for your program. Something to remember on this is the F945 was part of the phase 3 requirement. So you want to make sure that you are current with that and in compliance. When it says all staff, you want to make sure that you are considering your direct, indirect care staff, all of your contracted staff, and then volunteers, if it's appropriate for whatever role your volunteer plays. You want to make sure that they are also receiving your infection control education. Again, if you guys noticed in today's SOS that training of agency nurses was a frequent deficiency. So they may get infection control training and education through their company before they come to your facility, but that doesn't necessarily mean that they know all of your facility specific guidance on, different specific nuances for your facility. So make sure that they are receiving that as well. So let's go ahead and go to the next slide. So with your infection control training, you want to make sure that if there's any changes in your facility population, that you guys are addressing that. Maybe all of a sudden you have an increase in how many chronically ill people you're taking, or people with more wound care or C. diff. So you want to make sure that if there's any change in your facility population, that you're addressing that in your education. And that may be providing some additional education above and beyond what you provide at orientation. So if you have a new case of C. diff and your staff have never received any kind of education on that, you want to make sure that you do some in-services and get your staff trained on that. Also, community infection risk. If you have a higher TB case rate for your area, you want to make sure that you're covering that as well. When you're providing education, you want to make sure that the national standards are covered. Oftentimes we're reading those QSO memos, and those QSO memos refer us right back to the national standards and the CDC. So make sure that that's covered in your education as well. Staff turnover. This one is a big one. When you're building your infection control education program, you want to make sure that you're building it with some redundancies. We have experienced a high rate of staff turnover, whether that's because of the epidemic or just staff burnout, whatever the case may be. We've seen a lot of gaps in services and compliance. So make sure that your infection control program and your staff training address that. So you have a way to prevent any holes in your system. And that way you can hopefully prevent any future deficiencies. And then your facility's physical environment. So, location of cleaning supplies, where they can find infection reports, those kind of things. So make sure that that's covered. The last component of this that you want to make sure that is covered is your facility assessment. Make sure that if you are doing any revisions and you notice anything specific to infection control, that you update your infection control education to also cover that. So let's go ahead and go to the next slide. So the biggest piece of the infection control training is obviously F880, which is the infection control program. So the training program needs to cover all of the following items, and I'll just kind of touch on these. Again, this list is not all inclusive, but should at least include these items. So hand hygiene, another one. If you saw our SOS on this, hand hygiene is a big area for staff education. PPE use, injection safety, point of care testing, cleaning of devices. You want to make sure that your staff understand what contact times are and that they're using the right disinfection for the right pathogen. So you want to make sure that, go review your infection control education and make sure that all of these areas are covered. Again, that wiping of patient items or the point of care items like your glucometers, that one I've seen on multiple F880 tags. So again, just make sure you're covering all of those things in your training. So let's go ahead and go to the next slide. Okay, first and foremost, all training should support your current scope and standards of practice. Again, refer back to the CDC. Make sure that you're reviewing those glucometers and see what's approved by the manufacturer's guidelines too. So just some kind of reminders on that. Overall, training should include learning objectives, have the performance standards, some way to evaluate whether or not your staff are competent and that they've learned what you need them to learn, and that you can feel comfortable with them, with their infection control practices in your facility. And then make sure that it also addresses any potential risks. So if the procedures are not followed. The last piece of this, and again, this is another area where we see a lot of deficiencies, is you may have a process in place to train your staff, but you're not tracking that staff participation. You also want to have a process in place that if you assign a staff member a training program or to attend a training, you want to make sure you have a process in place for making sure that they are following through. The goal is to get all of our staff trained on infection control. So if you assign a staff member, just by assigning them does not meet that requirement. They actually need to attend, and you need to be able to show that they have attended and that they're competent on that. Surveyors will actually interview your staff to determine whether they have any learning needs when it comes to infection control. And you need to make sure that you're addressing any learning needs that they have. So whether that's remedial in-service education, if they identify that they don't understand something, we need to make sure that we're following up. So again, that's a good opportunity to build in some redundancies, have a process of reviewing their evaluations and then identify those need for further education and further learning for your staff. And then again, review your training tracking sheet to make sure that all of your staff have attended that training. So let's go ahead and go to the next slide. So one of the different avenues that we're looking at are the different training options that are provided or that are out there, if you will, for infection control training. So these 5 training programs are ones that CMS has said to have they've vetted and they meet all of the criteria for an infection control program. They have all of the different modules, cover all of the different training lead requirements, and that they also have a way to track whether your staff have attended and then evaluate whether or not they're learning. Let's go ahead and go on to the next slide. So I am going to turn it over to Larissa Skinner, one of my colleagues at Mountain Pacific, and she is going to delve a little bit deeper into the QSEP, which is the Quality, Safety, and Education Portal training.
Awesome. Thank you, Callie, very much. I appreciate your introduction. Can everybody hear me well?
I can hear you.
Perfect. So I thought today we're going to talk about the QSEP training, and ultimately it is one of those programs that Kelly discussed as meeting one of those CMS approved or vetted trainings for infection control. One of the reasons why we chose to discuss QSEP a little bit more into detail is the fact that it was recently updated. So I believe it was in March, end of March, we received notification that it was finally updated with the new guidance. And so we wanted to dive into that a little bit. So that's my goal. And please, if there's questions, don't hesitate to put it in the chat. I know looked like Katie had a question, and Jessie gracefully or gratefully, I having a hard time finding the right word, added in there the response to Katie. So, all right. So if we can go to the next slide. All right. So what is the QSEP training? A lot of people, and I know I come from a nursing home background. I worked in a nursing home for quite a few years, and I really did not know what the QSEP training was for a long time. And so it is out there. It's been around for quite a while. There's a lot of different training modules that you can choose to take, including some of the training modules that the state surveyors take as part of their training. So I highly encourage that you take the time to look into all the modules that they have available, but specifically today, we're going to be talking about infection control. So the QSEP is the CMS training for nursing home staff and management. And the benefits of the QSEP training, the biggest one, it is a free training. There's no cost to you or your facility, which we know how we have to be cost effective and cautious. So it is self-paced. So when you're trying to schedule your staff members to come in to do their training, you don't have to dedicate a lengthy amount of time to their training. They can take it in increments of time that their schedule and your schedule allows. It is a scenario based. So there's a lot of different caveats and different discussions about they're more case specific. So there's a little bit of troubleshooting and kind of get our brains thinking about how to best meet each scenario. it is available 24 hours a day. So we know how hard it is to get our staff members to come into our trainings in the nursing homes or the hospitals or assisted livings due to having, 24-hour coverage. And so having a training that it is accessible 24 hours a day definitely helps in meeting those needs of your night staff and your morning staff and day shifts. And again, it was recently updated to meet the guidance. If we can go to the next one. The goals for the QSEP training is to, again, provide the free training to the nursing homes and to be easily accessible. It provides best practices to prevent the spread of infectious disease as well as COVID-19, providing a training that with flexibility for staff members, regardless of their schedule. And one part that I really appreciate about the QSEP training is that there is a pre and a post test. So you can kind of see the knowledge gain from when you before you took the training and post your training. The QSEP training could really be utilized in combination with your current infection disease training that you might already have in place in your facility. But it can also be utilized as its own program for your agency. If we can go to the next one. Alrighty, so when you assign or when you log into the QSEP training, you'll go to the website to create your login. And there's two different infection control trainings. One is for your frontline staff, and that will cover, it's a little bit quicker. It will cover your hand hygiene, the screening and surveillance, the cleaning, cohorting, and caring for individuals with dementia. And then there's a manager training that includes your basic infection control, your emergency preparedness and surge capacity, emotional health to be able to, work with the other staff members who might be struggling, telehealth for nursing homes, and the vaccine delivery system readiness. If we can go to the next one. So again, I thought I would just take a quick little picture of what that the modules look like. So this is what it will look like as a frontline staff member logging in. Again, it breaks it down into each one of the modules. So ideally, you would take obviously module number 1 first, and then you kind of progress to the next ones. One great thing about the QSEP training that it is new this year, or with this update, is that there is a test out option. So let's say I assign one of my CNAs to take this course, and she is on module number 2 for screening. When she accesses that module, it will give her a choice to test. And so if she meets the criteria for the scoring, then that's required to pass the test, she does not actually need to take the module. And so that can greatly expedite your amount of time that you're taking the training. And so I think that's a great process. So for the sake of this training, I also failed, and all disclaimer, I failed on purpose to show you what it looks like. So if we can go to the next slide. All right, so here's the management. So as you can see, is a lot more detailed. There's some other modules that are included for the management for, kind of obvious reasons. There's more reporting, emergency preparedness, and surge capacity, those are roles of the management for your agency. And so again, same process. There is the test out option. And so if your staff member, again, scores highly enough, then they can jump to the next module. If we can go to the next one. So here is the pass and the fail. So when you opt to test out, again, you will bypass that module. If you fail the module, you will have to you cannot retest again. You will have to take the full process, the full module again, or the complete module. So I actually tried to access to see if I could expedite and try to test out again. It would not let me do it. So, which is great. It's kind of one of those barriers or training protocols that, if you do not test and receive the proper scoring, that means you really need the training. And so Yeah, if we can go to the next one. So one of the other things that was included with this new update is they call the Kuddos Kit. There are different little perks that they thought it would be attractive to your staff as well as to your facility. You can see where there is a little certificate you can print to your staff of completion. You can also print a letter that you can post within your facility that pretty much says, you know what, we trained our staff, we met our goal. It's been satisfactory. There will be a great piece of documentation to show surveyors when they come in for for your survey, for research or ongoing. There's also a little badge that you can print to maybe gift to your staff member who completed the training. So I thought that was neat to mention. If we can go to the next one. Alrighty, and again, you know, the benefits, I can't express this enough. There is no cost. Again, some of those infection control trainings, they are pretty costly to your agency, and we have nursing homes and facilities who are they're not corporate level, and so there's a constraint there with finances. It has been vetted by the CMS and as an approved infection control training. The participation, this is also a great point of the QSEP. Participation and completion is tracked for reporting. And so as a Mountain Pacific, we have a reporting process that we have been asked to complete. And so we receive the reporting for the nursing homes as where they're at in completion. The goal for the QSEP training in CMS is that 75% or above of your staff members have been trained. And so we're able to manage to kind of look at those numbers and seeing if there's areas that we can be of assistance. The flexibility, the engagement is actually pretty fun. There's little cartoons and it can be a pretty easy type of training. And sometimes those easier flowing programs are, you know, we retain some more of the information. And again, the test out option. If we can go to the next one. And here are just a couple of the resources, kind of how to log into the portal. Again, when you log in, when you access the website, you will ask for you to create an account. You add your email address and just some basic information, and you have access to all those trainings, including the surveying ones and infection control. I think I saw a couple questions on the chat. Yeah, the one downfall I think is the CEUs are not available for QSEP. Kelly said it quite well. CEUs are not available for QSEP. They may qualify for CNA contact hours. And so I think it'll be important, you know, that could be something to be asked to your Department of Health and your licensing. That could be definitely a question. We can try to follow up on that as well. But there is a certificate that becomes available once you complete. The other questions, do we have access to completion for others or only the individual? So I hesitate to speak to that just because I have not fully received the full pieces of information that I need to answer. Can the facility have access to the full completion of their training? So there is an option, and we can add that on the chat as well for group attendance. This is where you might bring QSEP training to your all staff training, and a group of your staff members will complete together. This is a piece that I think we need to research a little bit more. And then if we find out more information, we'll definitely send it out and maybe revisit that doing a soon or a next It's Worth a Shot. We can bring that up to you. But Kelly added the group QSEP in the chat as well. I'm new to infection control. Who can I contact to discuss this? Are you talking about what are you speaking on, Scott, as far as the certificate type of, or the licensing? Okay, so I would encourage for you to access the website. I think you get in there, sign up as an individual and start kind of poking around, start looking around the trainings that are available. And if there's more specific questions, please don't hesitate to email myself, Kelly, any one of us at Mountain Pacific. And if we don't have the answer, we'll definitely find the answer for you. But I think it's worth a while to access and start trying to navigate. Take the training yourself and see if it's of benefit to your facility as well. And maybe you can combine your facility's infection control training with the QSEP as well. Alrighty, well, I think we are a little bit past our time, so I'll turn this back to Jessie and she can close us off.
Thank you, Larissa. Yes, please reach out if we can be of any assistance. Otherwise, I would definitely kind of take a look at that QSEP link that was dropped in chat and sign yourself up. Takes a little bit of time to navigate and get situated as far as how the dashboard is and the training courses. And there are some options in there, as some have noticed, that have CEUs attached. So, and there's also some modules in there that I'll note that have group training options. So be mindful of that if you have multiple people that you would like to get that module in front of, that you are selecting the group training option when that's on there. I'll also note too, just in closing, some great news that we have initiated some conversations with some travel agencies, some nurse travel agencies, about having folks complete QSEP training prior to coming to your facilities. So they would come with a lot of this information in hand, which, would be extremely helpful. Again, we've initiated that. We'll see how that goes. And I would encourage folks, if you have a checklist that you provide to your travel agencies that you currently contract with, make sure that you have some of this training incorporated or options incorporated into that checklist. Kind of make them work for you. So with that, thank you, everybody. Reach out if we can be of assistance, and we'll follow up too on how that dashboard looks on how to access completion and certificates, if you have to have maybe a certain access level and you can view them all, and we will let you guys know. So take care, be well, until next week. Thanks as always, everyone.